So once again, this is a Thankathon 2020 presented by Douglas College. And tonight we're talking about the science of gratitude and well-being. We have two incredibly accomplished women we're going to hear from tonight. And I'm very excited to talk about this topic. If you have a question, please use the question and answer functionality in the webinar, and then we'll get to the questions periodically throughout this presentation. And for those of you who don't know, my name is Arnold Smith. I'm the CEO of the New West Chamber of Commerce, and I am your host and facilitator today. I would like to thank Integrated Analytics and Research Ltd. They are our sponsor for tonight's entertainment, if you will. They are a research consultancy based in Vancouver, Canada, and they support the needs of public and private sectors in evidence-based decision-making, with a particular focus on education, training, demographics, economic and social development. Their aim through research is to help you decide wisely. The founder and principal is Dr. Scott McAlpine, PhD, and he's not only one of the smartest people I've ever met, he's also one of the nicest. So my sincere thanks goes out to Scott and Integrated Analytics for their support. Now, speaking of really smart people, I am thrilled that we get to hear from two, I think, of the most accomplished women in Canada from the perspective of mental health. So we're featuring an interview with Dr. Jyoti Samra, who I'll introduce more fulsomely in a moment. But we also have here with us live Dr. Janel Casey. Dr. Casey, if you want to unmute yourself and say hello.
Hello, yes, thanks for having me here.
Oh, you're welcome. So Dr. Casey, on top of being an MD, is also a fellow of the Royal College of Physicians of Canada. She is the head of the Department of Psychiatry at the Royal Columbian Hospital Foundation. She's acting regional division head of adult psychiatry for the Fraser Health Authority and mental health and substance abuse program. So is that all one title, the acting regional head for mental health and substance abuse? Is that right?
Yeah, well, it's all part of the program of mental health and substance use. So all of our psychiatry program is within the MHSU umbrella.
Wow, and so you're leading on to that. Well, I'm really honored that you've taken some time to be with us tonight. So we're going to alternate between a recorded interview with Dr. Samra and Dr. Casey and talking about a similar topic, but not exactly. But since this is a gratitude challenge and this is part of Thankathon, I wonder if we could start this with just talking about acknowledging something we're grateful for today. Do you want to start? Do you have anything that you're grateful for today, or shall I start?
Oh, me? Well, I think I'm thankful for kind of every day. I've had some friends lately and family that have become sick, and some people struggling with a bad diagnosis of cancer. One of my colleagues has recently had to leave suddenly with a diagnosis of cancer, and she was told that she probably only has about a year to live. And she's my age with 2 young children. So I think I'm just trying to really appreciate every day and be mindful of how lucky I am to have my health, to have a job, to have my family. And so I'm trying to appreciate all the little things. And even when it gets frustrating, when I'm tired, the kids are wearing me down, I'm just trying to be grateful for that I have them, I have my family, and I get to be here and I get to watch my kids grow.
That was really powerful, Dr. Casey. Thank you for sharing. I too, I've been working really hard, and so I haven't been spending a lot of time with my kids. And so we went down to the water park today, and they chased me around and got me all wet. And I also agree that sometimes just those little things make all the difference. And so I'm really grateful for my 2 daughters who make me laugh and smile every day and just give me all those kisses. Anyway, so starting with some gratitude, just to show how powerful that can be. Now we're going to get into a video with Dr. Samra, and I'm just going to read her bio because she's accomplished a lot. So Dr. Jyoti Samra, our psych, is a national thought leader on issues relating to psychological health, wellness, and resilience. She's CEO and founder of My Workplace Health, a full suite national workplace consulting firm, and Dr. Jyoti Samra, our psych and associates, an in-office and online virtual clinical counseling practice with offices located throughout BC. She's highly regarded expert in psychological health and safety. And over the past 2 decades, she's been involved in numerous national initiatives that have contributed to policy change in Canada. She is a founding and ongoing member of the CSA Technical Committee that developed the National Standard of Canada and for the National Standard of Canada for Psychological Health and Safety in the Workplace. Try say that 3 times fast. This standard is the first of its kind in the world and is shaping policy development for workplace PH and S at the international ISO level. Thank you for having PH and S in your bio, Dr. Samra. She's received numerous awards and accolades for her clinical research. I had the pleasure of meeting her a couple of years ago, and we hit it off. And so when I invited her, told her about what we were doing, she was more than happy to come and talk to us. So we're going to put it over there. Now, it's going to be kind of weird because I'm interviewing her, so there's going to be live me and recorded me, but don't let that freak you out. We'll just have to roll with the punches. So go ahead. We have our excellent video person, Dr. Deepak, helping us from New West TV. And so it's going to be over to you. Deepak, go. Dr. Samra, thank you so much for being with us today. We're really excited about the Community Gratitude Challenge, and I'm so grateful for you to take the time to really explain, what are the benefits of gratitude. And
I can, and I am so grateful to be talking about gratitude with you because it is perhaps it's certainly in the top 3 of my favorite topics when we think about our psychological health. And so what we know is this from the science, that gratitude is immensely good for our psychological health and our physical health. And there's a whole host of evidence that will tell us that our overall quality of life is better. Our relationship health and the quality of our relationships with those we love and care about, as well as those in our work environment, are better. We know that rates of anxiety are reduced, rates of depression are reduced, and physically we have a whole bunch of positive immune boosting functions that come along with gratitude. And don't we all want to keep our immune function good and healthy and strong these days? Yeah,
that's certainly a good idea. It's amazing all the benefits of gratitude. I think when you really dig into it, and just everything you said is just so exciting. I'm really excited to how this is going to go. So I think from a chamber perspective, obviously, Deepak, we're going to cut that for right there. So Deepak and I were just having this great conversation. It's so great to be virtual. We wanted to try and get it done together. It didn't quite work out. Okay, so Dr. Casey, we just talked about the scientific benefits of gratitude, and that was the question. I got accidentally muted there for a second. But what are some other scientific ways to improve your well-being in addition to gratitude?
Yeah. So there are, several ways to improve your mental health and wellness. One thing is to improve your physical health. So exercise is very good. We know that can reduce anxiety and improve, especially mild depression. Eating well is important, as well as drinking well. So drink lots of water, but limit caffeine, as that can increase anxiety, and limit alcohol, which I know is hard to do right now during COVID times, but that would be important because alcohol is a depressant and it can cause depression and anxiety. Also, try to get good sleep. And there's a lot of tips and tricks for sleep. If you Google search sleep hygiene, there's lots of rituals, practices that we should be doing always to try to get a good sleep schedule going. Another thing would be to improve your thinking. So you can improve your thinking with certain types of therapy, such as cognitive behavioral therapy. So this is a type of therapy that looks at you're changing your thoughts and your actions to eventually change your feelings. And you can get this through a psychologist. We have a group program at Royal Columbian Hospital. And there's even apps that you can download on your phone for free. And so one is called Mind Shift CBT, and I recommend that to people to download and practice daily on their phone. And I think this is something we should all be practicing. I know we, as doctors too, we always tell patients to exercise to stay physically healthy, but I also think we should be telling people to, exercise our minds to stay, psychologically healthy. And I think that's just as important as our physical health, of course. Another way to improve your mental well-being would be to have a connection to things that are bigger than yourself. So That could be, for example, joining a cause or volunteering, something for like a charity. That gives you kind of a feeling of purpose and a connection to others. And it just gives you kind of perspective and meaning in life. And then one last thing is to build a healthy support network. So I know, again, that's a little bit more difficult right now during this pandemic, but I think it's really important to make sure you stay connected to family or reconnect to old friends, and just do it FaceTime, Zoom, regular old phone, whatever way you can stay connected. And even join a club. Again, it is important to socialize. Again, a lot of these clubs might be virtual or very small numbers, but it's still important to try to have some degree of social activities.
That's awesome. Deepak, we're going to get to the video just after this comment, but I just want to say, you said connect yourself to a bigger cause and then also develop a social network. One way to do that might be to join a thankathon challenge or a community gratitude challenge, because it also builds up your network, but it also is something bigger, because I think, if we can really generate a tidal wave of gratitude in the community, it'll make everyone feel good. So I just thought I'd give that a little plug there. Okay, Deepak, over back to the interview for the next question. We hope. Did I lose you, Deepak? Okay, well, that seems like, what the great thing is that we have this preeminent expert of mental health with us live. And so when our technology fails us, we get to just go back to Dr. Casey. So Dr. Casey, I had a question about, so the next question that Dr. Samra was going to answer was, what can people expect from practicing gratitude? And I thought that she sort of addressed that, but she said some really great stuff. So hopefully we'll get to hear her. But I wonder if you can talk to, obviously just feeling grateful for a couple of moments may make you feel better in that moment, but then, reality can kind of come crashing down. And I know I speak this from, I really do try and practice a lot of gratitude, but when you have the intensity of life right now, when you have all these things happening, they come back. So maybe you could speak to, like, what is the kind of the path for recovery? What should people expect? You talked about kind of changing your thoughts, and I know that maybe some people might get impatient with the process. Can you talk a bit about that?
Yeah, sure. Well, I think anxiety, stress is something, first of all, to note that something that everybody has. So we all have some anxiety, and actually some anxiety makes us productive. For example, if we didn't study for a test, or if we didn't, get anxious about studying for a test, we probably wouldn't do it. And then we wouldn't study and we wouldn't do well in the test. So, a lot of successful people have, a decent amount of anxiety that keeps them motivated and keeps them on top of things and makes them quite productive and successful. So I think when it becomes a problem is when it becomes to an overwhelming level, and then you actually lose your ability to function. So when it impairs your functioning is when it becomes more of an issue. And then anxiety tends to kind of wax and wane throughout your life. It's kind of a chronic condition for most people. There's periods where it's better and there's periods where it's worse. And again, we all do feel worse during times of stress or when there's a lot of difficulty.
Dr. Samra, thank you so. Okay, I think we got Deepak back. I just see if let's finish Dr. Casey's thought. Boy, I love technology. Talk about anxiety and stress. So please, hopefully you can remember what your thought was there.
Yeah, no, and I think for managing the anxiety and stress, I think that cognitive behavioral therapy works really well. And part of changing your thoughts and behaviors can include those gratitude, routines and rituals. So I think you're changing your behaviors, your actions, and you're trying to change your thoughts and trying to challenge your negative thoughts, so that you do see the positive in things. You can see, the glass is half full. It's not always half empty, and it takes practice and it takes, hard work and effort, but over time, you can really change those thoughts and actions, and it can make your feelings better, your anxiety better, your depression better. And so we definitely recommend CBT as well as exercise and those other kind of wellness things I spoke about. And only when the anxiety gets, more severe or crippling, kind of do you really want to maybe actually get a referral to a mental health professional, a psychiatrist, a psychologist. Your GP can refer you to a psychiatrist, and you can consider, of course, medication to help with that. But on the mild to moderate end, or the more routine ups and downs we all have, all of those other kind of wellness activities are really important.
That's great. I think we're all back to the interview. Go for it. I'm going to shut down my video so it doesn't. Dr. Samra, thank you so much for being with us today. We're really excited about the Community Gratitude Challenge, and I'm so grateful for you to take the time to really explain, what are the benefits of gratitude, and really what does the science say about gratitude? Can you talk a bit about that?
I can, and I am so grateful to be talking about gratitude with you, because it is perhaps it's certainly in the top 3 of my favorite topics when we think about our psychological health. And so what we know is this from the science, that gratitude is immensely good for our psychological health and our physical health. And there's a whole host of evidence that will tell.
Okay, so that's working perfectly and not increasing my anxiety or stress at all. It's so interesting, when you're practicing, we've prepared for this for a long time. We've been working on this all day. We've rehearsed it, a half dozen times. Well, at least we had some of the technology worked out, and there was some hiccups, and we thought we had it licked. Anyway, I got to apologize to Deepak at New West TV, because I think I threw this kind of in between videos and going back and forth at the last minute. So this is all my fault, everyone. I'm taking responsibility for this. So I thought what you talked about with that path was really great. And you were mentioning something around just overcoming anxiety and kind of having it be, something that people deal with on an ongoing basis. Is it just about discipline? Like, what is something that people can do, or I guess, what should people expect from when they have anxiety? Because it feels like it should go away.
Yeah, it can be really debilitating, especially when you get physical symptoms of anxiety, such as panic attacks. There's a huge mind-body connection, right? So, your heart can be pounding, you're short of breath. You can be dizzy, you can feel like you're going to pass out, or you're going to have a heart attack, or you're just going to go crazy. So people, of course, it feels really uncomfortable. A lot of people end up going to the ER even, because they actually do think they're maybe dying or something really wrong with them physically. I do try to tell people that it's not a bad thing that you're feeling that way. That is a normal physiological response to a stressor. So if you were in the olden days and the saber-toothed tiger is chasing you, you would want those symptoms. You would want to be breathing heavily. You'd want your muscles to be tense. You want your heart to be pounding, because you need to fight or flight, right? So you need to be prepared for the attack, and it would be healthy. It would actually be a really good response to have. So it's not dangerous and it's not going to kill you, but it does feel uncomfortable when it happens at the wrong time. So I kind of say, panic and anxiety, especially those acute periods of anxiety where your body is giving you all of these alarms, is kind of like a car alarm that's just too sensitive. So it's not bad that the car alarm goes off. It's good. It's supposed to go off. But it's just kind of weird when the car alarm goes off and there's nobody near the car. Nobody walks near the car and the alarm is going. And it's frustrating and it's annoying, and it just it's not working quite properly. But it's not dangerous for the alarm to go off. So I try to remind people it's okay. Their body is having a natural response. It's just at the wrong time. And therefore it really doesn't feel very good. And I think some things to do in the moment are to, try to do some relaxation exercises, deep breathing, trying to visualize something nice, soothing, muscle relaxation. You know, a lot of us are tense all the time and we don't think about how we need to drop our shoulders and not be so tense. And then in the long term, it's kind of practicing that cognitive behavioral therapy where you are, you know, constantly thinking, well, what is the threat? Like, why am I anxious? What am I worried about? And is it something I really need to be worried about? And am I thinking more negatively? You know, if I think, oh, they're not going to like me, or, you know, I'm an idiot, I'm stupid, I'm a loser, you know, like, what is the evidence for that, right? Like, that's usually just coming from inside you. Whereas, you know, externally, there's lots of people that like you. You've done lots of things that show you're not a loser. You know, you've done well at your job. You've done different things that, I mean, you have family and loved ones, or, you know, so there's lots of evidence. There's actually a lot more evidence that you're not a loser than evidence for. So, you know, logically, we can try to teach our brain that, you know, it's not that bad. It's not as negative or ominous as we initially think. It's just really trying to challenge those automatic thoughts and kind of step back. And sometimes you have to really work on that, and keeping journals, writing things down, kind of looking at the evidence, and using that rational part of your brain. And it does take time and practice. And I think it's something that we all have to kind of practice. And I think we all struggle with sometimes. There's none of us that kind of become unscathed from anxiety at all, and they're ever going to have really stressful periods in their lives where they're going to experience it and have to practice these things.
Yeah, no, I love what you said around, you know, the alarms from your body. I recently read a book, How Emotions Are Made, Lisa Barrett Feldman. And I think that one of the things she talked about in the book was just how when the alarms go off, we're bad at interpreting that. Like, we're just walking down the street, we have a thought and it triggers an alarm and we think, oh, something's really, and then it becomes that nasty cycle. And, you know, talking about, you know, making yourself feel like a loser, like, you know, maybe you have a webinar and you have these two incredible women and then the technology doesn't work. And boy, you could go down that path quite a lot. Or you could focus on, hey, you know what, we have this webinar, I've got Dr. Casey here on live and we can keep talking. So by the way, either one of those could win in any given moment. And depending on what happens, that's kind of, that ends up with the feelings. I think what we're going to do is we're just going to pull the plug on the technology side and we're just going to continue the chat. And what we'll do is we're going to post Dr. Samra's video on the Thankathon website on our own page so that people can come back and just see that anytime, because it's definitely well worth it. She's got some great things to say. She talks about how to use gratitude at an organizational level. She talks about it, some of her own personal rituals. So it's a really great interview, which we'll finish, but we'll make sure to get that sorted out another time. So Deepak, you can just relax, and we're just going to finish with Dr. Casey and go with that. So now, one of the questions that I asked Dr. Samra, and I'm really curious about for you, is just mental health at the societal level. And especially, like, obviously, you know, my thought is if we can get a whole bunch of people practicing gratitude, it's going to increase the well-being for everybody. What are your thoughts on some ways that we can, as a society, focus more on mental health, and what would happen if we did that?
Yeah, I think, I mean, I think we are becoming more aware, obviously, as a society. You know, events like this, and there's been so many conversations, even during the pandemic, about how to make sure that people are mentally well, including frontline workers and everybody dealing with it, and how is this affecting everybody's mental health. So it is good that it's becoming more aware, and I think we're becoming more aware, but I also think, like, the incidence might be going up, and there might be, you know, a lot of factors there too, and some of it might be that disconnectedness. We're on social media and we're comparing ourselves, and you know, teenagers are doing this, and it's a whole different generation now, and we're not maybe as connected outside of screens as we used to be, and so I think that's making it a lot harder for our mental health, and things are stressful. We're expecting to get more done in a shorter amount of time, and we have to be the best and the brightest, and it's like this race all the time to get ahead and be successful and have a good reputation, and so I think it is really hard in society to not kind of feel stressed and be questioning yourself and judging yourself and thinking that everybody else is judging you too. And so I do think it's really tough to manage all those feelings. And I think that as a society, I mean, I do think that that awareness is helpful. And I think people coming out and being more open about their feelings, because again, I think social media and things make us all look so perfect on the outside, right? People think, oh, you have it so together. You never have any problems. I wish I could be like you, right? But nobody is that perfect. Nobody is, that's too good to be true. That doesn't happen, right? So people just don't understand, because especially when you look at things like social media, people are always putting their best foot forward. You don't put the pictures of your messy house with your, kids running around naked and eating cereal from the box dry because you didn't make them a meal yet. Like, you don't put those things on social media. You put your best picture on there, right? And all your awards or, stuff like that you want them to see. So I think we have this huge ideal, but I think people are now, celebrities, all kinds of people are coming forward now with their stories of saying, I struggle with anxiety, or I struggle with bipolar disorder, or I have, whatever mental illness, and I need to go to rehab, or I'm going to see a psychologist or psychiatrist, or I got to talk to my counselor on a regular basis. And I hear people talking about that a lot more and more. And I think that's great that that's opened up that door for people. And I think people are recognizing it more in kids, and they're recognizing it all over the place, workplaces. So I think that they are kind of recognizing that, and also trying to give resources for people to get help quickly when they need it. And I think, as a society, I think practicing gratitude is very good too, because we do have a lot to be grateful for too as a society. I was talking to someone the other day, and one of my patients, and he was saying that, even though he was in the hospital, he was saying that it was actually, he didn't know why he was feeling so down, because he actually had a lot going for him, and he felt actually pretty grateful, and his mood picked up really quickly from when he first came in. And he said that, just having all his family kind of rally around him, and having a good education. And then we kind of, as a group, said, yeah, I mean, even by nature of living in Canada, we're just living in this country makes us more fortunate than, over half the world, right? So, the pandemic's not as bad here as it is in a lot of other countries. We have good healthcare. We're not at war, where there's a lot of, no one is starving. We have access to all this food and technology and healthcare. Like most of us are not really suffering when it comes to that. So I think we're kind of projecting our internal thoughts of ourselves, and really we should be looking at how good it is in the community and society, and how there are people. And I think people don't recognize that there are people that want to help you and want to be your friends. And I think sometimes you just have to look for it, but there are people to help.
Yeah, I think it's true. And oftentimes we're so reluctant to reach out for help because we don't want to admit the struggle. We don't want to admit that there's anything wrong. We think that, we're supposed to have it all together. It's one of the reasons why I was very impressed with your initial comment when you talked about what you're grateful for, and just, some of the things that were happening. Because I think it's so, I think it's a gift when someone is vulnerable and really talks about what they're going through. And if more people did that, then we wouldn't have such kind of high expectations for being perfect. So I think that's a great comment. Now, there's a couple of things I want to get to before we let you go. It wasn't meant to be a long interview, but one is you talked about some resources available, but there's also this really cool new mental health facility at Royal Columbian Hospital. Can you tell us a bit about that in any order you wish, whether you want to end with resources, because you kind of mentioned that a bit, but tell us about this new facility. How does it work, or like what kind of things are there? How is it going to help us all?
Sure. Yeah, I can start with the building. So our new mental health and substance use wellness center at Royal Columbian Hospital, it opened this July, and it was a $260 million project, with about $9 million of that being raised by donors. So first of all, we're very appreciative to all of the donors, and many of those were local businesses or local people. So we're very grateful to them. And this project was, obviously many years in the making, but we had input from various stakeholders, including even people with lived experience. So people who had actually experienced problems with mental health and had maybe gone through the system a bit. So that was really helpful too. And mainly we wanted to create a space that was therapeutic and inviting. We wanted to be spacious, and we wanted patients to feel safe and respected, and like they were very supported in their recovery. So it has lots of windows, it has natural light, it's got views of the Fraser River, and it's very nature-inspired kind of tones and colors and First Nations motifs. So it's really quite a beautiful building. And then we expanded all of our programs. So obviously it's a much bigger space than what we had before. And so now we have an expanded outpatient department. So that has clinics in it, such as our reproductive psychiatry clinic. That's for kind of pregnant and postpartum women. We have an adolescent psychiatry clinic. We have an older adult psychiatry clinic. And we have a new addition of addiction services. So we have a lot more addiction within our building, which was kind of separate before, but now we're, like I said, we're all under the one umbrella of mental health and substance use. So we're thinking about all of those, and we can treat, both of those at the same time. We're also, of course, doing those group therapy, including the cognitive behavioral therapy, like I spoke about. And we have a lot more technology in the new building. So of course, we're doing virtual assessments. A lot of our assessments right now, of course, for outpatients are Zoom, just to try to keep people safe and at home. We also increased our inpatient program. So we used to have 32 inpatient beds, and now we've gone up to 75. So each patient gets their own room, which is a lot bigger than before. They also have an ensuite bathroom, which we did not have before. You had to share before. And then we have some new elements like exercise rooms, comfort rooms, and outdoor patios. So that's probably one of my favorite parts, is the outdoor space where you can sit outside on a bench or on the green turf, and you can lay out in the sun, and you can actually see the Fraser River and the sun shine on you and get the fresh air. We also have a 10-bed psychiatric high acuity unit, and 20 beds is also our older adult unit. And that's Fraser Health's first geriatric psychiatry or older adult psychiatry unit. So that's a regional unit where we're getting people from all over Fraser Health to help some of our older adult population. And that's specially designed for that population as well. We also have a space for research and for teaching. I do a lot of teaching with UBC, so I always have, I'm a UBC grad myself, but I also have UBC residents and medical students with me kind of constantly, and we have our own academic program in Fraser Health as a kind of a subdivision of UBC, which is really great and important, because then we use that to recruit the new generation of psychiatrists. So all of my recruiting lately, I've hired about 10 new psychiatrists over the last 2-3 years, just for our hospital, at Royal Columbian Hospital. And it was much needed, but a lot of them are recent graduates from our academic residency program. So I think that's, again, making our program really great with a lot of great psychiatrists.
That is a lot of great stuff there. Now I want to open it up. Hopefully you have time for some questions. I don't know if we're going to have any, but if anybody has a question, just go ahead and put it in the Q&A. But I do want to ask one question, because I think this is on my mind, to be quite honest. The pandemic obviously has really increased uncertainty for so many people. It's put a lot of pressure on people financially. There's obviously the worry about getting sick. There's the challenge of having different viewpoints of how you should approach it, even within your own family. At what point would you recommend where it gets too much? I mean, you talked about kind of impairment, but sometimes, I sit in front of my computer and I try and find the thought, and it just doesn't come, because it feels like there's 5 different thoughts competing for space. At what point is it the right time to reach out to a professional?
Yeah, I definitely think the pandemic has increased the numbers, the presentations of mental health issues that we've seen. And of course, initially at the beginning of the pandemic, people stopped coming to the ER because everyone was in a panic and they stayed at home. They were afraid to leave their house. And so we saw kind of nobody at the Royal Columbian Hospital. And then the numbers started to gradually go up as people got comfortable coming out. And now they're, of course, really increasing because this is not a short-term thing. This is dragging on, and it's anticipated to continue to drag on. So like you said, all of those stressors like loss of employment and income, just not even seeing family, being isolated, right? So that stuff is taking a toll, and we're definitely seeing more anxiety, depression, psychosis even. So it seems like most of the patients that we're admitting now are, the pandemic has affected them somehow, or has been at least one of the stressors that has probably been part of their presentations. So I do think we have more people reaching out for help, and which is good. And I think there's a lot of course, resources you can use first before you get, too overwhelmed. And of course, we hope people can do things like different wellness. I've got a list of things too, if you want those after too. But I think mainly, if you're getting to the point where you're really not functioning well, you're not able to get out of bed, you're not taking care of your hygiene, you're not showering, you're not cleaning your house at all, things are falling really behind like that, you're not able to enjoy, anything in life, like nothing really makes you happy or excited, you're feeling hopeless, and then certainly if you're feeling at all suicidal or that you'd rather be dead, we definitely want you to, talk to your GP, talk to a counselor or a psychologist, or you can even self-refer yourself to any of our mental health teams. Our hospital and our local mental health teams all take self-referrals as well. So don't be afraid to come in and get like a professional assessment as well.
So if you're just feeling like, hey, I'm not feeling great, I can't get over it, just go and ask for help.
Yeah, and you can, if you have a GP, you can start with your GP. A lot of the GP's offices have counselors too. There are a lot of good resources too in the Canadian Mental Health, the Canadian Mental Health Association website. So they have a lot of programs like counseling. They also have other things like we were talking about with being well and wellness. They have like programs and modules and courses that you can take. So again, before you get to that point, you can just try to enhance your skills for helping you kind of take control and make a difference in your life. They have a program called Living Life to the Full. They have another program called Bounce Back, for more, again, mild kind of moderate depression, anxiety. We're like a self-guided program with videos and booklets, and they teach you skills. And they also offer telephone coaching. And so a lot of those are through the Canadian Mental Health Association website. And also if you have the COVID-19 app on your phone, which is a very good app, and it talks, it has the things like the self-assessment questionnaire, the testing sites, if you need a swab, where to go. It also has a link to resources, mental health resources. So if you go in that section, it lists a lot of these things. It actually has quite a bit. It has specific things for frontline workers, youth, different types of people. So it has a lot of good actual resources. There's a website called Here to Help. So it's heretohelp.bc.ca. That has wellness modules. So you can actually do, there's 8 different worksheets and they all have a different theme. So like anger management, stress and well-being, sleep. So there's 8 of these different themes and modules that you can, again, just do for free to learn about this stuff and learn how to practice these things. And of course, Fraser Health also has a substance use and services access team. So there's a 1-800 number for that to get connected to, again, counseling, or if you need something more like a treatment center, it helps get you connected to those things, because right now, of course, we are seeing really increased numbers of substance use. The opioid crisis is more a crisis than it ever has been. We're seeing the highest numbers of opioid deaths that we have since the beginning of this whole thing. So we're really trying to push our substance use services as well, because we don't want to keep seeing these needless kind of deaths happening anymore. And then there's also a Fraser Health crisis line as well. And again, a lot of people think that that's for suicidal people, but you don't have to be suicidal to call the crisis line. You can call if you're just feeling overwhelmed, stressed. I have some patients that just call it when they're lonely, and they just call, they have a nice conversation with someone on the phone, and then they go back about their lives. And I didn't even know about it until, a few weeks later, and they just said, oh yeah, one night I felt really lonely and bad, and I called the crisis line, I felt better, and then, carried on with my days. So it's a good resource to use even when you're not suicidal or that much of a crisis. So of course, we'd rather people reach out sooner rather than later.
Well, rather than try and put all this in the links in the chat or something like that, I think what I'll do is I'll reach out to you and I'll get all those. I'll put this recording on the Thankathon website under the Science of Gratitude section, and then those links will be there so that if anybody's watching this video down the road, just look below the video and the links will be there. I thought you were just great, Dr. Casey. I thought that you were so articulate and so easy to listen to. I thank you so much for being here. Now, before we go, one quick question. Since this is a Thankathon, is there anybody that you'd like to thank?
Oh,
I don't put you on the spot on that one.
That is a good question. I mean, I have lots of people to thank, honestly, but I mean, I definitely thank my work colleagues. I have a great team of people I work with. That's why I like my job, and I like being head of the department there, because we have about 35 psychiatrists, but they are honestly my second family, and I call them my kids. I always say I'm on the phone to my work friend, and they really are my friends. So I'm not actually lying when I say that. And we vent to each other, we support each other, and even when there's politics or we've got a lot of work to do and it just seems impossible, we support each other. And I think that makes, a job worthwhile. It's the people you work with. It's not so much the pretty new building I have. That's a bonus for me, but even in the old building, I chose to work there because of the people. And then I guess my husband I'd have to thank too, because he actually keeps a lot of the stuff going when I'm busy and trying to work late and do extra things for my job. And he has to wrangle 3 little children and keep them out of my hair. And so he's managing them upstairs right now so that they don't pull one of those stunts where they come in the background and interrupt my conversation.
Well, thank you to your husband, and thank you so much to you. My wife is also downstairs with our 2 kids, wrangling them. I think she's actually watching as well, so I think that's great. But I just want to once again say thank you for taking the time to be with us here today. I don't see any questions, so I think that's we're going to be able to wrap it up. But this is one of the reasons why we're doing the Thankathon. When you reach out to someone and give them a thank you and they feel appreciated, they might turn to you instead of something else like a drink or something harder. So it can make a profound difference. So please keep the thank yous going. If you want to participate each day, and really this isn't about just the 7 days of the Thankathon, but it's also about just kind of getting into that habit of really sharing, being grateful to the people in our lives. So that's what this is about. Thank you, Dr. Casey, for taking the time here today. I think I could probably say thank you probably 4 or 5 more times, but instead of doing that, I'm just going to say good night, have a great evening, and I'm looking forward to spending some time with my family now. So thanks again, and bye for now.
Yeah, thank you. Thanks for having me.
You're very welcome.